Welcome P6. In our previous lesson, we learned about heart attack, which is one of the health problems of the circulatory system. Heart attack is the death of segment of heart muscle caused by a loss of blood supply. The blood is usually cut off when an artery supplying the heart muscle is blocked by a blood clot. If some of the heart muscle dies, a person experiences chest pain and electrical instability of the heart muscle tissue. Now, we will be learning about the high blood pressure. High blood pressure is also called as hypertension, and it can cause a multitude of serious medical problems. The good news is that there are medications and lifestyle changes that are very effective at treating problems with blood pressure. Damage to the body slows down or stops when blood pressure is brought under control. Now, in order to understand hypertension, it is first necessary to understand what blood pressure is and how it occurs. Blood pressure is recorded with two numbers. The systolic pressure, the higher number. This is the force at which your heart pumps blood around your body. The diastolic pressure, or the lower number, is the resistance to the blood flow in the blood vessels. And they're both measured in millimeters of mercury, or mmHg. Everyone's blood pressure will be slightly different. What's considered low or high for you may be normal for someone else. The normal systolic blood pressure is 120 millimeters of mercury or below, and the normal diastolic blood pressure is 80 millimeters of mercury or below. High blood pressure occurs when the force of the blood flowing through the blood vessel is too high. It is a common condition in which the long-term force of the blood against your artery walls is high enough that it may eventually cause health problems such as heart disease. Blood pressure is determined both by the amount of blood your heart pumps and the amount of resistance to blood flow in your arteries. The more blood your heart pumps and the narrower your arteries, the higher your blood pressure. This higher pressure puts extra strain on the heart and blood vessels. And over time, this extra strain increases your risk of heart attack. Now, you can have high blood pressure or hypertension for years without any symptoms. Even without symptoms, damage to blood vessels and your heart continues and can be detected. Uncontrolled high blood pressure increases your risk of serious health problems, including heart attack and stroke. High blood pressure generally develops over many years, and it affects nearly everyone eventually. Fortunately, high blood pressure can be easily detected, and once you know you have high blood pressure, you can work with your doctor to control it. It's not always clear what causes high blood pressure, but certain things can increase your risk. You're at an increased risk of high blood pressure if you have a relative with high blood pressure, are over the age of 65. Gender study shows that men are more prone to hypertension than women, especially below the age of 50. After the age of 50, women are at a higher risk for the disease because of menopause. Race, like African Americans, the higher blood pressure levels of African Americans are associated with higher rates of stroke and congestive heart failure. That's why changes in our lifestyle is very important. Other risk factors includes smoking, stress, maybe you do not get much sleep or have disturbed sleep, no exercise, overweight, poor diet, you eat too much salt and do not eat enough fruit and vegetables, you do not do enough exercise, You drink too much alcohol or coffee or other caffeine-based drinks. Making healthy lifestyle changes can help reduce your chances of getting high blood pressure and help lower your blood pressure if it's already high. Now, high blood pressure usually has no signs or symptoms, so you do not know if you have it. You can only know if you have high blood pressure by having your blood pressure measured. That is why it is often called the silent killer. A few people with high blood pressure may have headaches, shortness of breath, or nosebleeds, but these signs and symptoms aren't specific and usually don't occur until high blood pressure has reached a severe or life-threatening stage. The only way of knowing whether you have high blood pressure is to have a blood pressure test. All adults over 40 are advised to have their blood pressure checked at least every 5 years. Getting this done is easy and could save your life. Now, doctors can help you keep your blood pressure to a safe level by using lifestyle changes and medicines. What works best is different for each person. That is why changes in your lifestyle is very important to reduce blood pressure. These lifestyle changes can help prevent and lower high blood pressure, like reduce the amount of salt you eat and have a general healthy diet, eat more fruits and vegetables, lose weight if you're overweight, exercise regularly, stop smoking, cut back on alcohol, cut down on caffeine.